but I wanted to talk about a relational red flag. In general, when you think about the therapeutic relationship, there's a lot of similarities to other relationships that you might have with any other person. And the main pillar of those relationships is safety. So if you don't feel safe in the relationship with the provider physically or emotionally to be able to be open and honest about your concerns, what you're going through, if you don't feel like the trust is there or you're not being respected in some way, that would be a red flag. And I don't know if this is something that you'd be able to see coming from a mile away before you get into the room with someone. Obviously, the more data that you get, the more time you spend with them, the better and more clear this will be. But if you start getting these little glimmers that the provider is unreliable or inconsistent, they're crossing your boundaries frequently or crossing their own boundaries, things that were set up in the informed consent paperwork, those are the hints that you can keep taking to decide whether or not therapy is going to be effective with that provider, of what they can offer for you.
Got it. Yeah, I appreciate it. That's cool to hear everybody's opinion and Jenna kind of bringing in a different angle there. And I think one of the things, and I can kind of give some insight here too, like as a police officer for over 10 years and military for over 12 years, is like a lot of people don't even know what these trauma-based modalities are, kind of the things that you mentioned, right? They hear EMDR, CPT, and they're like, what the hell are those acronyms? You know what I mean? I think, and that's kind of why, like with the Overwatch Collective, what we've done and what our goal is to have multiple therapists in every single state to do a podcast with every single one of them, but then also to become a top contracted therapist. We kind of do that work for that first responder service member to kind of take that guessing game out of it. Because I don't know if some of the EAPs are doing thorough vetting. I've heard some are, but a majority are not. So, and we'll talk about this later, but if you go for the first time to a therapist and it's not what you thought, or you're seeing a lot of red flags and they're like, okay, I'm done, I'm out, I'm never going to therapy again. So sweet. Okay, question number 2. What is ineffective therapy versus harmful therapy? What situations should result in terminating therapy together versus what kinds of behavior should be reported? Jenna, can we start with you?
Sure. This one's tough, because for people that aren't maybe necessarily in the field, they might not know that this question could also be a little bit political. And so I'm going to just zoom back and take a really general perspective of this. An easy way to think about ineffective versus harmful therapy, it's in the names. Ineffective meaning generally doesn't work, doesn't do anything to treat the problem that the client's coming in with, and harmful being does actual damage, and can make clients worse throughout the process. What I've seen is that when you have an ineffective therapy, generally the therapist is well intentioned. So they have every intention to work with this client. They're motivated. They care a lot about them. They're staying focused in sessions, but the client either initially has a little bit of improvement and then it stagnates, or there's no improvement from the first session all the way to, whenever they're having a conversation about if it's working or not. Whereas harmful therapy, there will be these degradations in the client's progress. So they actually will get worse during sessions or after sessions. You'll see them deteriorate, and things that maybe weren't problems before become problems. The list of, like, I wish I could give a list of just here are the list of harmful therapies. It's not as simple as that. But I think if you look at what the research is telling us, is if you can invite the client as part of the feedback process, and the provider is the one that's getting that feedback at the end of sessions and is tracking with assessment measures to look at the things that are important to the client, you can see whether or not a well-intentioned provider is going to make an effort to pivot and do something that would work, or not. But again, the issue with the harmful therapy is a lot of time there's negligence involved in that, and it doesn't matter on the therapist side. If there's negligence, they're not going to be able to utilize that feedback and make any changes that would be useful. So it's complicated.
Got it.